Hi, my name is Diana Berrent. I am the founder of Survivor Core, and welcome to the Survivor Core webinar series because we know that you can't always get to the experts. So Survivor Core is here to bring the experts to you. And today we have two amazing guests. But before we get to that, I want to tell you one very important announcement. That huge study that we did of 4,000 mostly non-hospitalized patients back in August, the largest of its kind. Well, so many of you have joined us since then. We wanted to make sure that everyone's voice could be counted in that study. So we've opened it up just for 1 week. It's open through Wednesday night. We're up to, I think, 4,500, 4,600 as of this morning. I'll be posting updates. So please complete it. It's on our website. Go to surveys and reports on our website, survivorcore.com, and please share it in every network you're in, every group you're in. And look, we have 115,000 members. There are plenty of Survivor Core members who you can convince to fill it out to, because the more people who do it, the stronger our data is and the more we can get accomplished. Just remember what Dr. Fauci told us last week. So today, it is my honor to welcome Dr. Tiffiny Hron and Josh Duntz. So first, I'm going to give you just a brief introduction of each one of them, a little bit of the bio, and then I'm going to let them speak for themselves and tell you what they have to offer all of us. So for Dr. Tiffiny Hron first is a laryngeal, is that?
Yeah, laryngologist or laryngeal surgeon.
Okay. Surgeon at MGH Center for Laryngeal Surgery and Voice Rehabilitation. She received her BS in Health Administration and Policy from Creighton University in 2002, MA in Medical Sciences from Boston University in 2004, and her MD from Boston University in 2008. Josh Duntz developed his passion for breathwork and humanity performance during his 10-year career in the Navy's Special Operations community. While transitioning out of the military, Josh was looking for a holistic approach to stress management and performance optimization, which led to the founding of Stenosis. He now works with patients recovering from COVID-19 and military operators and their families to deliver proven breathing techniques to lower stress and anxiety while increasing overall performance. That's my not reading properly. Josh has completed a 100-hour breathwork certification course. He is consistently researching and experimenting with delivering the best breathwork practices currently backed by science. Please schedule your appointment with him below to get started. And you can do Stenosis for yourself. I will tell you, as you all know, I am a patient at Mount Sinai's Post-COVID Care Center, and the first thing that they give every patient is this flyer on Stenosis and how to sign up. So all of you who have not been able to be lucky enough to get into the Mount Sinai Center, because that is the vast majority of the country and the world, you will get to take advantage of some of those services. So Dr. Hron, can we start with you, and can you tell us about your practice and specifically more recently how it how it is applied to people suffering from long-term COVID?
Yeah, great. So I, like you mentioned, I'm a laryngologist, a laryngeal surgeon. So I'm an ear, nose, and throat doctor, but I really just specialize in the throat part of things. I'm at two of the academic hospitals in Boston, both Tufts and MGH, and this is exclusively what I do. So I've seen patients. Massachusetts had quite a large number, and MGH did as well. So I've seen quite a number of post-COVID patients with anything from structural pathology, meaning vocal fold immobility, stenosis, vocal cord scarring, to functional pathology having to do with respiratory mechanics, post-viral cough syndromes, and things like that, as well as just muscle tension dysphonia and getting their voice back. So I've had experience in both of those centers, as well as trying to coordinate efforts with pulmonology and cardiology, because dyspnea includes, or shortness of breath isn't always just your lungs, it can be your heart or your throat, and figuring that out definitely requires some coordination.
Wow, that's can you just elaborate a little bit and I know that you have treated a lot of people suffering with long-term COVID. Can you just give some examples of issues that patients have come to you with, and like what are the ones that you're seeing the most? What are the strangest ones you've seen? You know, if you could just give us a little bit more
Absolutely.
insight.
So I think with the larynx, it really is affecting, it depends. And I think it really depends on the constellation of symptoms and how COVID affects each person. You know, those with neurologic sequelae will get anything from dysarthria and dysphagia, similar to what you would see with a stroke patient. But by and far, the majority that I'm seeing are more the dyspneic and dysphonic, so voice and breathing. And what's causing that is really varied. I've had anything from.
So I'm sorry, yeah, you have to
Yeah.
bear with me for my lack of medical knowledge. So are you making the difference between neurological speech issues and mechanical speech issues?
Absolutely.
Okay.
Neurological speech in the sense of what's called dysarthria. So the ability to form articulation in words. So you can get post-COVID patients that really have dysarticulation issues. And I think that's probably not as well described and well cared for, but it's definitely there. But by and large, the majority of what you're seeing in terms of neurologic issues with the larynx, so not necessarily articulation with mouth or palate, has more to do with immobility. So you can get one vocal cord that's immobile. You could get two, but typically if it's two, it's sometimes actually not immobility, but stenosis or scarring of those joints. I think there are two real big sequelae that happen from those that have been intubated, which is stenosis of either the larynx and or trachea, or vocal fold scarring, which is a bit different and specific really to COVID because.
Sorry, can you go back and can you explain the difference between those two, between stenosis and the second one you mentioned?
Scarring.
Yeah, what does that mean practically? I mean,
Yes.
stenosis is wearing down of. I mean, I've only heard of stenosis of the back. I've never heard of stenosis of the vocal cords.
So stenosis has to do with the narrowing, and when you think of the inlet, your vocal cords sit like a V right around the Adam's apple. They open to breathe, and then they close to talk and swallow. Then air right around your Adam's apple, so kind of higher up. If you feel that little dip in your thyroid cartilage, and then men have a very prominent protuberance, and that's right around where your vocal cords start. And they open to breathe, and then they close to talk and swallow. Then air from your lungs is pushing past them, and they vibrate, making sound. And then that sound comes up through your throat, which make you sound like you, me sound like me, and then your palate and your tongue form words, and that's how we speak. And so stenosis is really scarring or narrowing of the passage of either at the vocal cord level or the trachea, which is below it, or windpipe, before you even get to the lungs. And that typically is from a breathing tube phenomenon, where there's wounds that happen with the breathing tube being in your airway, and most people heal those wounds, but not everybody. And the reason everybody is more concerned with it with COVID is patients are intubated for longer periods of time. The longer period of time puts you at a higher risk for it. So that's
right. We have a member who is intubated for some period of time. He is vented and he has a continuous cough.
Yeah. So the stenosis, that's what stenosis is. The other thing that's really not well described, but is definitely part of it, is most of the time people are laying on their back. So that V part, the joints are at the back. The breathing tube rests typically around the joints. But when you prone patients, the breathing tube now goes between the vocal cords because they're on their stomach. And so you can get scarring from the tube hitting the vocal cords, which typically we don't see as much in patients that have been intubated. So you can have pure just voice loss. And I have had at least a handful of patients with this where they don't really have structural pathology in terms of breathing. It's just voice, and it's really bilateral scars on the vocal cords that are likely related to that breathing tube being there. So those would be the things that affecting really just the intubated patients. And then you have all the things that affect both intubated and non-intubated patients, including
right. And I would say that probably 80% of Survivor Corps were not hospitalized during the acute phase.
mm-hmm.
Any hospitalized for subsequent issues post-COVID or, long-term COVID, but not the ones who were intubated.
Right. And with those, what I see is anything from vocal cord immobility, meaning there's one vocal cord that doesn't move, that can happen in either. And that's likely related to just the viral infection on its own. But really what you see a lot of are long-term can't breathe, can't talk, and that can, or are having irritability, like you were mentioning, the chronic cough. That can be very...
Hoarseness. People are complaining about hoarse voices and...
Well, and what the hoarse voice can come from is anything from aberrant muscle function, how the muscles are coming together to form the voice, which is called muscle tension dysphonia, to anything from breath support. So if you don't have air to generate to the vocal cords, you lose power. And so you can have issues with that as well. So those issues usually combine to make more of the outpatients at home thing. And the severity can really depend. I have performing vocalists that may not have issues with their speaking voice, but have issues with their singing voice when they need more power. So all of those issues kind of combine. And then you have patients that may have muscular complaints that factor into that as well. Tense cervical neck muscles, anterior neck muscles, and then post-viral cough.
A lot of stiff necks.
Yeah.
That's a big complaint.
Yeah, I have too.
That could be that, and that's related, and that could impact the vocal cords.
Absolutely, because the muscles that support the voice are more on the anterior part of the neck. But if you're in a lot of pain in the back of your neck, you're going to splint with that pain. A lot of people can hold their stress up here where their shoulders are up, punching your jaw like this, and you don't even realize that, but those will affect your voice muscles and how you use your voice. So you can hear that in speech.
Do you know what it is about the virus that is creating these issues in the neck and the throat? And, I mean, the lungs seem to make more sense, right? Like, okay, it's a, somewhat of a respiratory, it's at least one component of it is a respiratory disease, but the rest of it.
Well, I think actually the breathing is more complicated than that. I think there is a big component with those where pulmonary and cardiac functions are normal, then what's going on? And I think there's a big component with altered respiratory mechanics that can be purely vocal cord related, where you get into this diagnosis of vocal cord dysfunction, paradoxical vocal cord motion, to pulmonary related hyperventilation syndromes and things like that. We most of the time open our mouth and breathe. We don't think about it. And then when you've been sick for as long as, COVID keeps people sick, you don't always just click right back into place, and so I think it's a combination of...
Is that like a dysautonomia function?
I think it's more a deconditioning kind of function and stamina kind of function. And then it leads to altered mechanics. And we see some of these issues with respiratory infections anyways, but you definitely are seeing it, I think, on a larger scale, mostly because pulmonary recovery is long, and then you have patients sick for so long, and oftentimes they were in pain for so long, and you just have this confluence of symptoms where things are really, being affected. And oftentimes I feel like they don't get to us actually soon enough. And
right, that's actually exactly what I was going to ask you. So, I mean, the obvious questions are, the people who are suffering from all of these issues long-term, what can they do, and what is your advice to them? And are there things that they can do at home? What kind of medical help can they seek? But before we get there, for those people who are suffering from COVID now, and they're in the midst of it, and they're obviously, 120,000 something, some astronomical number diagnosed just yesterday. What can people do to prevent that from happening they end up needing your care at the end of the day. Are there things that people can do during the acute phase to stave this off?
I think all the stuff that is being recommended from a pulmonary standpoint, getting up and walking, multiple times as much as you can when you're home alone, home recovering or trying to fight the illness is really helpful.
Right.
But
I'm sorry. I'm speaking specifically for people who are recovering at home and who are under no medical care.
yeah, so what has been typically recommended, what I have heard recommended in patients that are actively sick is talking about, getting up and moving and not just staying in bed. But the whole idea behind all of that is you want to maintain pulmonary function as best as you can. And really, the best thing to concentrate while sick or in the would be to optimize your pulmonary function as best as you can, because that's what's going to carry you through later. As you're starting to recover and the breathing gets better, but you may still be coughing, that's a pretty common thing coming off an illness like that. That's where you really want to get into cough avoidance strategies to minimize laryngeal irritability. And that comes with, so what causes our larynx to be irritable? Well, the virus, and we know this from other, coronavirus infections, that you tend to, in my belief with this is that you tend to kind of get the irritability because it just resets your cough center. So where normally you might respond to mucus or reflux or irritation in your throat at a higher level, now it kind of just resets you lower. So things that normally wouldn't bother you suddenly do. Most people recover through that pretty quickly, but some actually, it takes months to really get through that after the severe.
I remember I felt like I couldn't get a deep enough breath. I was afraid of laughing because I was afraid that I was scared to laugh or to talk too much or anything in that first 10 days. That shortness of breath is very frightening.
It is. I mean, breathing is something normally you take for granted. You open your mouth and breathe, and then when it's gone, it's.
So what can you do specifically?
So when you're recovering and that the breathing is starting to let off, but you might be still struggling with a cough and those irritable symptoms, staying well hydrated. When you feel the need to throat clear, cough, or tickle, using a lozenge or a sip of water, those are calming things to the throat that can help to suppress those drives. Those then take you further out. Things to be mindful of, things that really make, I think, when I hear patients talking about, I wish they had come in sooner, or if you started to actually feel better in your breathing, but the breathing gets worse, that is a sign to me something else is going on. That's, a sequelae that needs an evaluation, particularly, upper airway evaluation. Things that get better, but then get worse are more concerning, particularly in the recovery phase. But those good vocal hygiene would be what I would recommend at home. And then exercise as much as you feel comfortable and safe doing. And if you're struggling, then making sure that from a cardiac pulmonary perspective, it's appropriate for you to be exercising.
Yeah, I have found, and I'm curious to hear Josh's perspective on this in a moment as well, but I am almost 8 months from as what I call a Tylenol and Gatorade type of COVID. I, recovered at home, and I am mostly back to normal with some, a couple of annoying lingering symptoms, but nothing that, is really terrible. But and I'm not fatigued, but I can't exercise. I don't feel like I can do cardio exercise in the way, but I'm not short of breath. And I don't know that I would have understood the difference between fatigue and inability to exercise until now. Because I had always, I was an exerciser before this. So that's really interesting. So are there when you talk about vocal hygiene, what does that mean exactly?
Vocal hygiene, so it means, think about it's about making an environment in your larynx that's conducive for healthy function. And that includes anything from being well hydrated, because thin mucus is like oil greasing the inside of your larynx. You don't want thick, clumpy oil in an engine. You don't want thick, clumpy mucus in your
Oh, a
throat.
lot of people have suggested Mucinex. Is that something that you would be behind, or?
Well, plain Mucinex is okay. I don't. There's no contraindication to it. Some people find it very helpful, but by far the most helpful thing is actually just hydration. So, and it's not all at once. It's consistently throughout the day that is where it's most effective. You titrate the amount of water you're drinking to your urine. You want nice pale yellow to clear urine, then you know you're drinking enough. And then after that, it's coughing and throat clearing avoidance when appropriate, when you feel more of a tickle, not that deep-seated cough like you need to get secretions out of your lungs out. Then walking, pulmonary support, those are healthy kind of habits. And then the one last one is the concept of what's called a vocal budget. And a vocal budget is that everybody has a certain amount that they can talk, that we're beyond those levels, they get to a place where they have voice loss. They just strain. It's like you go into a concert and screaming. After a certain point, your voice is just done. And so particularly after an initial illness, your vocal budget may be smaller. And so being cognizant of what your needs are. And so if you were a teacher and you needed to go through class, but you're still kind of recovering, or you want to get on a webinar and talk, those are your performances. And so being mindful of what's around it. And then as you work to increase stamina, both from a voice perspective, you think about it as training for that marathon. You get more and more and more. And it's not just with exercise, but that's with voice as well.
And with those things, let's go back to the example of the member who just developed again, is that something that you would go to a doctor like you, or do you go to a neurologist?
I think you cut out the member that developed what?
A stutter.
A stutter. So that usually would be both a neurologist, but oftentimes they end up with ENT first because they're going to need some speech therapy. So oftentimes before you see a voice therapist or a speech therapist, you're seeing an ear, nose, and throat or a laryngologist to make sure the structure otherwise is unaffected. And you screen for other kind of issues like swallow issues and things like that. But the speech therapy would work on the stuttering part. Absolutely.
Well, my daughter had speech apraxia when she was young, so we spent years in speech therapy. So
yeah. I know one other concept to be thoughtful of is there are different types of therapists, just like there are different types of doctors and ear, nose, and throat doctors. A speech therapist can specialize in primarily swallowing, which is what you usually see at the hospitals. They can specialize in voice, which has more to do with how the voice is sounding, and speech, which is more articulation, stuttering, what you see with kids in schools. And sometimes finding the right person can take time too. One of the great benefits of telehealth has been that voice therapy has gone online and virtual. So patients that didn't maybe previously have access to voice therapy services locally now have the ability to do that. And I know it's been a great benefit for our therapists and our patients here.
That's great to know. Okay, Josh, you're up.
Yeah, how's it going?
Good. Tell us, give us some background on what you do on your back. I mean, your background's super interesting, and how it all relates to long-term COVID.
Yeah, so when I got, I started doing these breathing exercises just personally with myself when I was still active duty in the military, mainly first off using it as like physical performance enhancement. So to increase my endurance and my VO2 max and stuff like that. And then later on, as I kind of started to dive more into the research and got certified as a breathwork coach, I realized that there were so many other aspects that this could help, with general stress and anxiety, PTSD syndrome, sleep, chronic fatigue, all these things. And so I just started diving more and more into it personally, started getting my friends to use some of these techniques. And then when I left the military, I just got really lucky and got linked up with Dr. David Petrino, who I know has been on the show before too. And so when COVID kind of kicked off and we realized how big of a respiratory issue it was causing in people, we started throwing together some programs that we thought would help people, recover and start to instill these functional breathing patterns, because what we were seeing over and over again was people hyperventilating, people not breathing properly, and then chronic fatigue, shortness of breath. 50% of our members at least self-report PTSD as well. So like a lot of the same symptoms that I was seeing in the military population is kind of a lot of the symptoms that we're seeing with COVID long haulers as well.
Stop. Breathwork, PTSD, explain.
Yeah, so what we do really at the macro level, what we're trying to affect is the autonomic nervous system. So it's a very holistic mind-body approach. So not just psychological issues, but not just physical issues, but how do we combine both of those and try to affect both of them at the same time without, forgetting about one or only focusing on one. So yeah, that's kind of how those things were related. So I'm definitely not trying to say that this is all psychological at all. I'm just giving you.
No. I am a deep believer in the connection between breath and emotion and all kinds of things. So I just wanted you to fully explain it for the rest of the world, because I am already a deep believer in this. I do the walking with the counting of the breaths and the whole thing. So I'm excited to get to that point as well, but I just want to make sure that everyone else had a full understanding of that as well.
Yeah, I think there's a lot of misconceptions around just that term still, PTSD. I think as soon as you say it, it's automatically related to the military population when, 75% of the country has been through some sort of traumatic, stressful event in their life. So it's not like, that could be a car crash or a loved one dying, really anything it's a very subjective thing. So, people can, whatever that trauma is to them is that to them. And I don't think anyone can kind of tell them that that's not, what they're going through. So after that kind of happened, David helped us set up a small pilot program with Mount Sinai, where I worked directly with some patients for a few weeks and saw really good results out of that, which then led to them bringing us on as like one of their official partners. So we started working only with patients being referred to us directly from Mount Sinai. And then word of mouth started spreading where, in these Survivor Corps, Body Politic is a huge group that we get a lot of new members from. So we have, we're working with people all over the globe now in Canada, Australia, Asia, Europe. So it's been pretty insane the past like 12 weeks as far as just like how much this has grown, because when I started this company, I had, the pandemic wasn't started yet. So I had obviously no idea that this is the route that we were going to be going, but it's been such a huge, just so fulfilling for me to be able to help people. And like, I'm getting emails every day from our members telling me like, I haven't been able to go on a walk in months, and I just went on a 4-mile walk with my daughter. Or I'm able to walk from the couch to the kitchen now, and I haven't done that in a while without like
shortness of breath is
exactly
the number one issue that we are encountering. So what do you do with this? What do you do with patients? Walk us through it. Tell us, first explain a little bit more about how breath work can regulate the autonomic system, and then can you walk us through what you would do? Like,
Sure.
Here I am.
Yeah. So for anyone that's kind of not familiar with that autonomic nervous system, it's really, it controls everything that goes on in our body on a second by second basis that we don't think about consciously. So, everything from your heart rate to your breathing pattern, to your temperature, your immune system, your sleep, all this stuff is regulated by that nervous system. And it's broken into two branches. You have your sympathetic side, that's normally referred to as like the fight or flight mode. And then the parasympathetic side, which is responsible for the body's like relaxation and recovery and adaptation process. normally those two branches are an imbalance of each other. So one would get activated and then the parasympathetic branch would kind of come online and recover from whatever that stressful event is. What we're seeing really common is patients being stuck in a hyperactive sympathetic state or this chronic fight or flight mode. And a lot of the members that we work with are going, just like yourself, 6+ months of kind of having these group of symptoms. So what we specifically do with our program is everything's designed around reactivating that parasympathetic branch of the nervous system, which you can do really well with these certain breathing patterns because it has nerve endings actually attached to our lungs. And then also with some slower respiration rates that we use, it's been found in clinical studies to increase heart rate variability too, which is like the best biomarker that we have right now that can show whether that nervous system is balanced or not. So
your heart rate marker is the best?
Heart rate variability. So what that does,
I don't know what heart rate variability means.
Sure. So it measures the variability of milliseconds in between each heartbeat that you have. And what they found is the more variable that time is, the more balanced your nervous system is. And then vice versa, if it's less variable. So it's like a specific, 1 millisecond in between each heartbeat.
How do you get that test? How do you test that?
So a lot of the smartwatches on the market now do that.
If it tells me this, I can look mine up.
Yeah, it should. I think
you go on. I'll be looking this up.
Yeah, so your Fitbit, like Garmin. I personally wear a Whoop. They're my favorite. That's on the market.
What's a Whoop?
It's just this little band that you wear on your wrist, and it tracks your heart rate variability. It tracks your respiration rate, all your sleep cycles. And
spell it. I'm going to be buying one in about 2 seconds.
WHOOP.
Okay, remind me later, guys.
And there's also another good company called Oura Ring. If you don't want to wear the wrist,
about that one.
It's a ring. So I just don't like the ring because I like to wear it 24/7. And when you're working out with a ring, it makes it a little difficult.
So Josh, this is my heart rate for the year. Can you tell when I had COVID? So
I see beats per minute. Yeah, it looks like, yeah, I can.
Is it subtle or no?
Yeah, it's pretty clear, I would say.
Yeah. And then when you can see where I had a symptomatic relapse over the summer.
Yeah. Yeah. So that's
okay, so that's amazing. So you can test that with just a normal fitness tracker. Mm-hmm. And then sorry, so go on. So you measure that, and then that gives you an indication of how regulated your sympathetic nervous system is.
Correct. Yeah. And something the Oura Ring specifically is really good because you can start an activity. And so we actually have members that have that, and within just a 10-minute breathing exercise that they do, some of their heart rate variability will go up as much as 20 points just within that 10-minute time frame. So you can get like a real live view of that nervous system being shifted just from these 10 minutes of breathing exercises.
Do you do any work with vagus nerve stimulators? Do either of you?
So what we do, we have a lot of members now too that are using cold exposure programs that we've put together for them to stimulate the vagus nerve. It's also really good to activate the parasympathetic system as well. Don't recommend it for everyone. It's kind of, if anyone has ever, athletes listening, done an ice bath or something like that, that's exactly what you're doing. That is really good for the vagus nerve. But again, it's putting yourself into a stressful situation, cold water. But by doing that consciously, your body responds to that stress differently than if it was like a subconscious stress that's coming at you from a different area in life.
Dr. Hron, have you used vagus nerve stimulators with any success or?
Typically what we're doing for targeting the respiratory mechanics has more to do with respiratory retraining therapy, with voice therapy, or respiratory therapists through pulmonary rehab centers.
Interesting. So Josh, can you lead us through a session?
Yeah, sure. So real quick, kind of walk you through some of the key things that everyone should be thinking about. One of the most important things for us is that we want everyone to take all their breaths in through their nose and out through their nose. So try not to breathe through your mouth as much as possible. That's a huge side effect we see a lot with people that are hyperventilating, and that have issues with breathing at night specifically, is they tend to be mouth breathers, which can drop your O2 levels pretty low. If that's something that you're chronically doing. So we recommend to all our members that we work with that they should be breathing through their nose at all times whenever possible. The second piece of that is the activating that breath cycle with your diaphragm. So another huge thing we see is the shallow upper chest breathing, where people aren't really getting the air deep down into your lungs. And that lower 1/3 part of your lungs is where most of the blood gas exchange process happens. So really important that you are getting that deep diaphragm, or belly breathing, or abdominal breathing is commonly referred to.
Can you give some tips on how to know that you're breathing through your diaphragm as opposed to your chest?
Yeah, sure. So there's a real simple technique. I'm just going to move my camera. It's called a high-low. So I would just place one hand kind of right in the middle of my chest on my heart, and then one right above my belly button. And then you can just start taking your normal breaths in through your nose, out through your nose. And what you're focused on doing is only allowing that bottom hand to rise and fall with each breath that you have. And you can see my stomach is the only part moving. I have no activation in this upper hand or upper chest area. So if this looks like, this is what it looks like when you're breathing, then you know you're doing that diaphragmatic breathing. That would kind of be step one for people to get used to it. Also recommend, it's much easier to get started by actually doing this lying down prone on your back, as long as you're not experiencing any severe dysautonomia or POTS syndrome. And then kind of step two would be to then take both hands and go right below the last rib cage. And now when you're breathing, you're really focused on getting that, not just the vertical expansion, but also the horizontal expansion of the rib cage too. So when you're breathing, thinking more of a 360 degree. For visualization, I like to think that I have like a balloon in my stomach, and on the inhale, that balloon is expanding and then, contracting on the exhale. And then one of the first kind of simple exercises that we'll have people do is just a 4-second inhale count and then a 6-second exhale. And if that's too aggressive for you, maybe starting off, if you're someone who's experiencing like real severe shortness of breath and decreased lung capacity, you can cut that down to maybe like a 2 or 3 second inhale and a 3 or 4 second exhale. The most important thing is to try to keep the exhale at least a second or two longer than the inhale. Because when you look at your breathing cycle too, the inhale portion actually activates that sympathetic branch of the nervous system, and the exhale activates the parasympathetic branch. So the exhale is really the relaxation response part of the breathing cycle. So the longer you can make your exhales, the more you're going to be able to activate that parasympathetic branch. And you can even see this happening in real time if you wear a heart rate monitor or a pulse oximeter while you're doing these exercises. You'll see when you go to inhale, your heart rate's going to go up a couple beats per minute. And then when you start that exhale process, it's going to go back down. And that's that nervous system being really in real time. You can kind of see it working. So that's kind of the quickest thing, that quick 4 and 6 count. And then, you can do that for 5 to 10 minutes. If this is something you're just getting used to, that real slow breathing pattern, that gets you down to 6 breaths per minute if you're able to maintain that. So you'll likely build up a little air hunger during that 5 or 10 minute exercise. If that happens, you can just stop the exercise and take a couple deep recovery breaths and then just start back where you left off. And then over time, the more and more you do this, as you start to build up a higher level of CO2 tolerance, that air hunger will get less and less, as the weeks go on, and you kind of recover more and more as well.
You're training for this.
Yeah, exactly.
This is a training regimen. And wait, just to make sure that I got it right, always in through the nose and always out through the nose also?
Correct.
Okay.
That's how we want. Yeah, we think that's the best option for people specifically. And I know you had some questions about how to get started with exercise. So all of our members, and specifically working with the PT department at Mount Sinai, is we're really regulating their intensity of their exercise based off their breathing patterns. So we will only let them get to an intensity where they can stick to nasal breathing the whole time. So if you, at any point you are getting to a point where you have to start breathing through your mouth, the intensity level is probably too much and you need to bring it back down, slow down your pace of your walks or your runs or whatever you're doing for that exercise movement.
Wow, that's fascinating. Any other exercises that we can do as a group?
Yeah, there's a bunch of different kind of things. Another really popular one is just a box breathing technique. So you can kind of picture it as a box where each leg of that box is a different pattern. So the inhale, you would inhale for 4 seconds and then hold your breath at the top for 4 seconds and then exhale for 4 seconds. Hold your breath for 4 seconds, and you just would repeat that pattern and kind of think of it as a box for each leg. Also, something that
wait. That you went pretty quickly through that. Let's do one of those. Let's walk through that again and let's do it together, because that went way too fast.
Okay, yeah, I'll kind of count for you guys, and if you guys want to follow that breathing pattern. So you would inhale for 4 seconds. So start the inhale, 4, 3, 2, 1, and then hold at the top for 3, 2, 1. Exhale. 3, 2, 1, hold, 3, 2, 1, and then inhale, repeat that pattern. And you can do that again for 5 to 10 minutes. Something else that's really common that we have some of our members do is just unilateral nostril breathing. So where they'll actually plug their right nostril and just breathe through their left nostril, again, with that same 4 and 6 second cadence. And that your nostrils are actually attached to your nervous system too. So the left nostril is the parasympathetic dominant branch and your right nostril is the sympathetic. So again, just trying to switch up these exercises and really targeting.
Do you do both sides, or are you only trying to focus on activating the sympathetic side?
So there's a couple different, some you'll inhale through your right nostril and then exhale through your left. And then some you can just breathe only through the left nostril, the inhale portion and the exhale portion. And we've put together structured programs for all of this, where it's just like an exercise program. So each day of the week, it'll tell you exactly what to do at what time of the day. And we have all those programs are available for people for free on our website right now.
That's so cool. Can you tell us a little bit about how to sign up? And then I have some questions from members that I want to be able to pose to both of you. But in the meantime, can you tell us a little bit more about the actual Stenosis program and how people can sign up? And
sure, they can just go to our website and sign up. It's stasisperformance.com. Once you sign up, you'll get prompted to sign up for an onboarding session. So you have the option to have a group onboarding session, and kind of we'll go through our 3 pillars around how we teach functional breathing, which we covered a little bit earlier. And then after that, you get sent the program, and then you can just get started with, following the program on there. And then also you have, the options of booking additional coaching sessions. We just hired some new breathwork coaches too. So in the next couple of weeks, we're going to be launching live on breathwork classes online. So that'll be like a group setting where, a breathwork coach will walk you through a 30 or 40-minute class. So that'll be really cool. And that's going to be free to all the members too.
Wow.
And then
so which part of this is free and which part do you need to pay for?
So the only thing you would ever have to pay for is if you want to do a one-on-one onboarding session, or you want additional breathwork coaching sessions. But
all the group things are
the group onboarding's free. All the programs are free once you sign up. And we put together a bunch of education documents too around the nervous system and stress and performance. That's all on there for free. And we're actually in the process right now of putting all this onto a mobile application as well. So you'll actually be able to connect to these wearables and like track your progress as you're doing the breathing
Oh, there's
exercises.
nothing I love more than tracking my data, as you can see.
Yeah.
I've got years and years worth.
Yeah, so we're really excited about kind of what the next few months are going to hold for us.
Well, that's terrific. Let's see if we can maybe set up a link from the Survivor Core website over to Stenosis, because it sounds like it would be an incredible resource for so many people around the country who don't have access to this sort of expertise.
Yeah,
where
that'd be
they
awesome.
Okay, I want to make sure that we get to some of these questions, and I will admit I did not have any breathing problems with COVID. I didn't have any voice problems, so these are not the things that I am most familiar with. So I'm going to read them as is. There will be mispronunciations and so on and so forth. So bear with me. Okay, and I'm also going to make sure that the ones that we haven't already covered. So, here we go. Following a bronchoscopy, I think that Dr. Hron, you mentioned this, but maybe to go a bit deeper. Following a bronchoscopy last week, my pulmonologist and neurologist diagnosed me with bilateral vocal cord paralysis, presumably caused by COVID. Can you explain this, and do you have any advice for me?
Yeah, so I think there, again, just to kind of reiterate, bilateral cord immobility. So when you see vocal cords don't move, it can sometimes be very difficult to distinguish if it's a true paralysis, meaning it's affecting both of the nerves to the vocal cords, which are on different sides of the neck, versus what's called a stenosis, where the joints themselves aren't moving. Paralysis is a lot less common, bilateral cord paralysis, particularly at the same time, than is stenosis. And if the patient was intubated, I have a real high concern that that might actually represent stenosis versus paralysis, although you just have to tease that out. So definitely seeing in that setting, and ear, nose, and throat doctor is going to be helpful. And because the treatment paradigms for both of those are different. Vocal cords can recover, and they can take up to a year to recover. Most recover early within 6 months, but that doesn't necessarily mean recovery is not zero for that second half of 6 months. And so in that situation, the best thing you're going to do is try to optimize breathing, whether or not they need a trach or steroids to get you through that 1 year. And then if it's stenosis, though, you don't wait a year. You would start treatment to open up that glottic opening right away with different endoscopic open neck techniques.
Okay. So a lot of people obviously are having pulmonary issues and are being given prescription inhalers to treat those issues. Are you aware of those prescription inhalers having negative effects on the vocal cords?
Yeah, so they can have great effects because, again, if you don't have air and they're really helping you from a pulmonary perspective, that can be beneficial. So there's definitely a beneficial side. The downside you see is primarily with steroid inhalers. Steroid inhalers can cause fungal infections in the larynx, and as well as the esophagus and the throat. You oftentimes in the mouth see that as thrush with white spots in your mouth, but you may not see it in your mouth. It may just be in your throat. And the way you prevent that is by gargling after all steroid inhaler use. That helps to kind of wash out the residue, hopefully.
With anything in particular, or just like
anything in particular? If you have a soda and you want to do it, it's just about washing the particles out afterwards. It's not perfect, but it can definitely help. So gargling after all steroid inhalers is definitely recommended.
These are the types of tips that sound small to you, but can mean the world to somebody at home who doesn't have access to that kind of information, which so many doctors can assume we know. But so many people are really just not under the medical care, the extent of medical care that they need to be.
One other thing I would say though about the steroid inhalers is some inhalers are more prone to it. So if you're somebody who's getting these infections a lot, it's worthwhile talking to your prescriber about trying a different one.
That's good to know as well. So, you know, when I had COVID, I'd never heard of an oximeter. They were not yet being used, or maybe nobody told me, I'm not sure. I think I was too much on the beginning of that one. But ever since then, that's all I've heard about is oxygen saturation levels. What would you suggest for someone whose oxygen levels plummet upon falling asleep? And I know that everybody's oxygen levels naturally go down while they're asleep, but is there a level at which one should be concerned? And are there ways that one can naturally increase that oxygen saturation level?
So I think you would definitely have to assume that it's also not happening awake, because if they have difficulty breathing as well during the awake hours, it's naturally going to be worse when you fall asleep, because the throat muscles that we activate and breathe when we're awake are nice and open, and when we relax and go to sleep, they collapse. So you can definitely have changes with that. The big concern in somebody who's telling me that would be the concern is not only are the oxygens rate dipping, but are they becoming hypopneic or apneic, meaning they're actually stopping their breathing. And if it's, small, minute amounts, you may not be aware of it all, but just have excessive daytime fatigue. And it can kind of lead to all sorts of other sequelae as well. So the way you would start to figure that out is really with the sleep study. The
what
fact
kind of doctor does one go to for a sleep study to do that? Because that does seem like a fairly common issue that maybe is contributing to more than we realize.
The good news about sleep studies is there are a lot of doctors now prescribing it. So a primary care doctor can order a sleep study, an ear, nose, and throat, a sleep medicine physician themselves. They're pretty easy to order. There are also ones now where they do home sleep studies. So you can, if you qualify, depending on what the symptoms are, they'll send the equipment, you do it at home, and you send that stuff back. So there are a lot of options to kind of get that, but it can distinguish really, I have some people who may drop their sats a little bit, but you get the sleep study and the amount of dysfunction is actually much greater than you think it is. So in that situation, I think talking to their doctor about a sleep study would be helpful.
Can I chime in on that?
Mm-hmm.
Something that's super common that I've seen with people that have that is sleep apnea normally, but a side effect is normally them breathing through their mouth at night. That can cause shallow breathing and cause their oxygen levels to drop as well. So again, goes back to that nasal breathing. Something that a lot of our members have been trying out is there's companies out there that make specific tape now to close your mouth at night that promotes nasal breathing. And we've heard great success. I've used it myself. It works great. So I would recommend people.
Tape on your mouth. That's interesting. I remember using tape across my nose when I ran years ago to increase the oxygen. Then I would get these ridiculous
Yeah, it just opens up the nasal passageways a little. But what this tape does is it presses your lips together naturally. So I mean, if you don't need to like freak out, you can breathe through your mouth still if you had to, but it just presses your lips to promote nasal breathing. Stanford actually just published a study where they had participants plug their nose and breathe through their mouth for 30 days straight. And they all went like 10x what their sleep apnea, snoring and waking up throughout the night, their blood saturation levels went down. And then they did 30 days where they closed their mouth and only breathe through their nose. And like 95% of those symptoms went away within 72 hours of these people starting to breathe through their nose at night. So that's like a real easy, quick fix. It's cheap. You can buy it on Amazon.
Are there other tips that either of you have of how to train yourself to breathe through your nose during the day, while you're awake? Are there?
I mean, the more you can be aware of your breathing patterns and catch yourself, like, not breathing through your mouth throughout the day, the easier it's going to be to ingrain that muscle memory pattern into your body. So that way, over time, hopefully that becomes your new natural way of breathing at night as well.
The one thing I would caution is sometimes if there's someone's truly desatting though, there could be actually bigger issues beyond just nasal breathing. So it would be something that really does, I think, need to be discussed with the doctor. And you could have a sleep study and still try those things, but untreated apnea can have big cardiopulmonary effects. So I definitely think that it definitely requires evaluation in addition to trying some of these things if you want, but I definitely would look. The one thing that I will mention is nasal breathing itself is a reflex. Breathing in inspiration through your nose will reflexively open your cords. So it's a great way to, particularly those who may have some aspect of vocal fold dysfunction, really opening those cords instead of spazzing them closed. But some patients may also struggle depending on if they have nasal issues going on, whether it's congestion, septal perforations, or deviations, but those can sometimes be managed medically as well to kind of optimize it.
There was a question about nodules being a result of COVID.
They are not. Nodules, which are bumps at the middle part of the membranous parts of the vocal cords that vibrate, are related to what's called phonotrauma. So they come really just from using your voice over and over and over again. Now, everything with voice is about demand, anatomy, what the structure looks like. It's your instrument, function, how you play it, and then the demand, what you're using it for. So I think sometimes these things get unmasked if post-COVID, because your breathing may have changed and now you can't compensate with the instrument you have, which actually is also kind of in some ways offers us some hope, because it means if we improve the breathing, that the voice and all that stuff may come back and you may not have to address the nodules at all because it wasn't an issue beforehand.
I'm just going through to make sure that, there were other questions, and I know we only have like 3 minutes left, so we can just do a sort of lightning round on these to get them. I haven't been able to sing without coughing for about 7 weeks. Higher notes make me cough. Are there exercises I can do for this?
Absolutely. So if coughing is a big component, not just during singing, but also talking, there can be cough avoidance strategies, the stuff we talked about, sips of water, lozenges, all that stuff to suppress the cough. The more you're able to learn to suppress it, it sort of sends those feedback signals to your brain to stop overreacting, the better it gets. Sometimes when it's isolated to something like the upper part of somebody's range, there can be either techniques you work with your voice teacher or with a voice therapist to get you around that so that it becomes less and less prominent.
Next one, to your knowledge, are there any dietary adjustments that's proven effective in treating post-COVID breathing and or vocal cord complications?
I think a healthy diet is probably the best, but the things anyway is high fruits and vegetables, low in fats, but that has more to do with, I think, an overall energy body wellness thing, where if you're not in pain and you're treating yourself well, you're exercising, you're doing some of these breathing techniques, your voice responds in kind, but it's not necessarily doing anything to the tissues themselves.
This question came in, there were 2 questions about this. I do not know what this is, about the EMST 150.
Yeah, so the EMST 150.
I'll tell you the 2 questions. One is, would respiratory training using the EMST 150 be beneficial for this population? Anyway, it's the same basic question twice.
Yeah, so the EMST 150 is a device that is used to kind of, it blocks some of the exhalation. So the idea, it's primarily used in patients with neurologic disorders, things like Parkinson's, where they have a hypophonic voice. The voice therapy around those conditions.
What does hypophonic mean? I'm sorry.
Yeah, so it means weak voice.
Okay.
a breathy voice. Now you can have a breathy or weak voice because you don't have air from your lungs, or you can have a weak and breathy voice because the muscles are inherently weak, as they are in some of these neurologic conditions. So what therapies are designed is actually almost to induce hyperfunction, to make them overreact. So in Parkinson's, there's something called Lee Silverman voice technique, where it's almost like a shout therapy. And the EMST 150 is really designed to kind of strengthen that. In post-COVID patients, it's not so much that you want to induce hyperfunction, you just want to induce a more efficient vocal pattern. So I don't think that those would necessarily be helpful to a post-COVID patient.
So we have run out of time. I think that we got through most of the major questions. Any last words from either of you, Dr. Hron or Josh?
Just thanks for having me on. I hope people got some good information out of this.
Yeah. Oh, absolutely. I learned a lot. Dr. Hron, do you have any parting words?
No, I just think the work you're doing is really great. And, thanks for the opportunity to speak about the vocal cord part of things. I think it's a big part of the rehabilitation effort, and we could do a lot more.
I do too. Well, thank you both so much. And this webinar, like all of our webinars, will be posted to our website. And as we just found out this past week that our website will be included in the Library of Congress's digital history of COVID. So not only will this webinar, along with all of our others, go down in the history of COVID quite literally, it will serve as a resource for all of the people who were not able to be here during this hour, but will be able to use it as a resource in the weeks and months coming forward. So thank you very much. We're tremendously appreciative.
Thank you so much for
Thank
having
you.
us.
Thank you.
Bye-bye.
Bye.